Hi, this is Dr. Sharma from Capital Pain. I'd like to thank you for tuning in to watch this short video. Today I'll be talking about occipital neuralgia. Probably asking yourself, what is occipital neuralgia? Well, I'll tell you. Occipital neuralgia is the inflammation or injury to the occipital nerve. It's a neurological condition. These nerves originate from the neck, usually between the C1 and C2 vertebrae, as you can see from here. There's a hole here, the transverse foramen. Once these nerves exit, they travel up the back of the neck to the back of the head, and they travel in between this occipital protuberance, which is the bump on the back of your head, and the back of the ear, which is called the mastoid process. Now it's important to note these nerves are completely sensory nerves. There's no motor component whatsoever, and they do exit on both sides, the left side and the right side. So now that we discussed what occipital neuralgia is, the next question you may be asking yourself is, how do you get it? Well, the most common causes of occipital neuralgia is trauma to the head, usually a concussion, or you could get it from a whiplash injury, which is often seen in motor vehicle accidents. In addition to that, you can also have instability of the neck between C1 and C2 vertebrae. This instability can cause impingement or pressure on the nerve. The nerve also exits out that area, and any impingement or pressure on the nerve as it courses up the neck can cause occipital neuralgia as well. Patients who often do repetitive neck contractions, such as flexion, extension, and lateral rotation, are also predisposing themselves to occipital neuralgia because there may be further instability in the neck. So now that we have discussed the causes of occipital neuralgia, I'm going to briefly discuss with you the associated signs and symptoms associated with it. Often patients will complain of a burning, throbbing, shooting pain in the back of the head, usually between the occipital protuberance and the mastoid process, which is behind the ear. Pain will be noticed on palpation. Patients usually complain of tenderness when you palpate the back of their posterior scalp. It can be on either unilateral or bilateral, meaning one side or both sides. Patients will also complain of problems with vision. Sometimes you'll have pain, it's called photophobia, along with nausea and vomiting. So here at Capital Pain, we offer a wide array of treatment plans for occipital neuralgia, starting off with the conservative measures such as rest, physical therapy, and non-steroidals. Often, if these measures do not provide adequate relief and your pain is still refractory, we can consider doing an occipital nerve block. So what does an occipital nerve block entail? Basically, it's an injection of local numbing medicine towards the nerve. We use either an X-ray, ultrasound guidance, or blind technique and inject the medication in the area and vicinity of the inflamed nerve. This medication usually involves a local anesthetic and a steroid and decreases the inflammation and tenderness to that area of the scalp. The procedure is relatively short, it's within a few minutes, and is relatively safe. We often aspirate first before we inject the medication to make sure we're not intravascular, as there's often a occipital artery that courses right around the nerve. The injection should provide quick relief, usually within minutes, and can last anywhere from a few weeks to 4 to 5 months. After this pain returns, we can consider doing another injection, or if patient wishes, we can consider more further longer acting definitive treatment such as radiofrequency ablation. You may have heard of this procedure before in other videos such as medial branch blocks and RFA ablation. However, this RFA ablation basically entails in using a catheter which is placed near the nerve and is heated. This heating causes a thermal injury to the nerve, so basically the nerve no longer can send impulses of pain in the back of the head. The nerve eventually dies off and there's no pain in that area. Usually it takes about 3 to 4 weeks for that nerve to completely die off. Now, the nerves do grow back about approximately 1 millimeter a day. So usually the relief from this procedure can be anywhere from 6 months to 18 months. Thank you so much for taking your time to watch this video. Appreciate it.